The Mind Deconstructed, Mental Health and Wellness with Dr. Kaz and George.
I'm Dr. Kaz Nelson, an American Board of Psychiatry and Neurology certified psychiatrist licensed to practice medicine in the state of Minnesota.
I'm your podcast host, George. I'm a licensed attorney in the state of Minnesota, but I'm not here to give you legal advice.
The statements of Dr. Kaz and George are not a substitute for medical care, and our opinions are our own. If you are experiencing a mental health emergency, please seek assistance from a professional.
You can contact us on Twitter at Mind Deconstruct.
Hi, podcast listeners. It's Dr. Kaz, coming at you today with a special edition of the Mind Deconstructed Podcast, COVID-19. I hate to have to do a podcast like this, but this whole coronavirus stuff is impacting all of us in various ways, and I thought I'd check in. You can probably tell George isn't here tonight. It's just me, and we could consider this a special edition. It's Friday, March 13th. I'm going to be talking about the coronavirus and COVID-19, but please know that things could change and the content of this podcast might change. But this will be a little bit like a time capsule of the moment and still worth connecting with you all today, even if things change. Today, there were 2,034 confirmed cases in the United States, 14 in the state of Minnesota. That number is likely an underestimate because widespread testing is still not accessible. Certainly, if somebody comes into the emergency department and has trouble breathing, they will be tested. We have that capacity. But just routine testing of people with cold or flu symptoms is not yet happening. Probably a lot of you have been following news on this, but just so we're on the same page, if you're wondering, what is a coronavirus? Well, coronavirus is a class of viruses. You know, viruses are different than bacteria. They're different types of germs, different types of microorganisms. Viruses are super tiny and very hard to treat. They're not treated with antibiotic medications like bacteria are. Coronavirus is a class of viruses, and we've definitely had a lot of these that we've been exposed to. Probably everyone listening has been infected with a coronavirus or 10 over their lifetime. It causes cold and flu-like symptoms. But why are we talking about this coronavirus now? What's the deal with that? Well, this is a new virus that has evolved out of that class. And the crappy thing about this bug is for some members of the population, particularly older people or people who have pre-existing medical or lung conditions, it's proving to actually be fatal. And we know from cities and countries that have had higher rates of infection, like Italy, South Korea, China, and Seattle in the United States, we're learning that very serious cases of this infection can quickly overwhelm the healthcare system. We're running out of masks, gowns, other supplies that are used to decrease the spread of infection. And incredibly tragically, in some cases, hospitals are running low on things like ventilators to help people breathe who are having very serious impact of the infection and actually need a machine to breathe for them while they're battling the illness. So this is something that we really can't shirk off or be complacent about. You might have heard people say, well, there's only been a couple cases in my state, or, I heard it's not so bad for young people. Why is everyone taking such drastic measures? Why are we canceling the NBA and canceling other large gatherings? Isn't this an overreaction? The answer is no, because what we're being asked to do is actually work together as a state, as a country, band together to put some physical distance, some physical separation between one another so that there is less opportunity for this nasty virus to spread from person to person and stay alive. The virus can only stay alive if it's inside a human being. It can't stay alive if it's just on a table surface for more than 48 hours. So we're trying to work together to kill this thing, basically, and remove its opportunity to stay alive by living on and within human beings. And so that's why the schools are being canceled. That's why these big sporting events, concerts, other gatherings are being canceled. Not because we think people are going to go somewhere and end up getting sick, although that could happen, but we're trying to stop the spread of this thing so that we give our healthcare system and people a chance to preserve supplies, preserve ventilators, and really have access to these types of healing tools for when they're needed, rather than overwhelming the capacity of the system to care for people struck by this infection. And so it's a very stressful time, and it's also kind of an inspiring time where we can all agree that it's us against the virus, and we have a chance to play a part in winning. We want to get rid of it. So that's why this virus is causing so much fear and stress. It is potentially fatal for people that we love, probably not for the most of us, but for certain people. And I think there's a lot of stress and concern related to the tactics and measures that we are needing to win this thing. So that's what this podcast is going to focus on today, the impact of this virus, the impact of these measures that we've been asked to take, and what to do about it. So in brief, I've come up with 4 main ways that this is impacting people very seriously on a day-to-day basis. Number 1 is general psychological stress. This is scary. It's frightening. We've had to make accommodations. We've had to change things. We've had to cancel things. We've been working to make ends meet, particularly if you're in an hourly wage job or you're wondering what you're going to do about childcare or how to pay the bills. These are real world considerations that are very stressful. So that's number 1, and we'll talk about that. Number 2 is grief. This is an important time in people's lives. Some of the things that are being canceled related to travel, spring break plans, birthday celebrations, funerals, once-in-a-lifetime types of opportunities that are occurring over the month of March and April, college classes, professional training, visits with loved ones. Canceling these things is not easy, and there's a true sense of grief and sadness associated with the loss of some of these opportunities that maybe we've been counting on or looking forward to for years. Number 3 is social isolation. As long as we're being asked to stay at home, for those of us that have homes or other types of living situations, if we don't have routine access to other human beings, friends, people that we usually like to see and visit with on a daily basis, people can start to feel a very intense sensation of isolation and loneliness. And so that's something that we have to address as well. And then number 4, something that's critical to talk about, and that's true panic. There is a percentage of us that the anxiety is so incredibly high that it's reached the point of completely overwhelming the system. And people might feel impending doom. They might feel sick. They might feel trapped. They might feel completely overwhelmed by their feelings and emotions. And of course, we have to attend to that sense of panic because that's untenable. It's unsustainable. And in the end, that level of panic is not effective in helping people meet their goals. But what I want to say first, before we kind of talk about what to do about these 4 possibilities, is that you are 100% absolutely entitled to your feelings. If you feel sad, angry, indifferent, relieved that something was canceled that you were dreading, guilt about feeling relieved that something was canceled because of the virus that's killing people. These are very, very, very complex feelings, and you are allowed and entitled to have your feelings. So as I talk about these 4 possible ways that this virus is impacting us as a society or as individuals, please keep in mind that I'm not telling you that you shouldn't feel a certain way or that you don't have a right to feel a certain way. Of course you do. You are completely entitled to your feelings. What I'm going to intend to do is actually validate those feelings and point out in some cases that these are universal experiences to some degree, or that you're not alone in feeling this way. And if you want to choose to take steps to reduce the intensity of how you're feeling, or to understand or distract or change the way that you're feeling, I want to make sure that you have the tools to do that should you choose to. But any of these strategies you are not obligated to take. Let's go back to our list of 4. The first one, general psychological stress. What you can consider doing as a first step is limiting your exposure to news stories or articles or press conferences related to COVID-19. It's not a bad idea to check in once a day on the status of things because certain things might be canceled or, in our case in Minnesota today, the governor declared a peacetime emergency, and that's good information to know. But if you're finding that you're checking the COVID-19 tracking websites several times an hour or combing over news articles, that might actually be contributing to your psychological stress that actually undermines your capacity to be effective in being part of the solution. What you can also do during this period of time to help with your psychological stress is to reach out to your supporters and people whom you support, whether that's over phone or video conferencing, FaceTime, Duo, those kinds of applications, assuming you have a smartphone or a video conferencing capability. Not everyone does. But if you do have access to those things, it can be very powerful to reach out to people and to share in this experience together so that you know that you're not alone. You could also practice what we would call emotion regulation techniques. So that's your toolkit that you pull out from time to time to help mitigate and manage intense emotional states. So that might be taking a warm bath or using aromatherapy or doing some light stretching or yoga or exercise, drawing, creative expression, even distracting by binge watching an enjoyable television show. These are all completely legitimate ways of distancing or distracting from something that's very stressful and intense if you have the luxury of engaging in those kinds of activities. And so give yourself a break, be kind to yourself. Remember that you have a toolkit. There's things that you can do to actually relieve stress and relieve the intensity of these unpleasant or fearful feelings that you might be experiencing. And then something else you could also consider, a very powerful method of channeling some of that psychological stress, if you're able to, is to actually engage in advocacy for people who might be more vulnerable than you. And so if there's some way that you can help support the arts or support hourly wage workers or support people who don't have childcare or help with meal distribution or delivery or those kinds of things, that is a way of channeling some of the stress into altruism or positive, productive activities to help your fellow human being. Again, not everybody has the availability or luxury to engage in those kinds of activities, and sometimes you're the one who's actually needing that advocacy or needing that help. But if you are in a place of privilege where those things are accessible to you, then you might want to consider the value in fighting for the vulnerable in the context of circumstance we find ourselves in. The second way I mentioned that this crisis is impacting us is our grief. Grief is a very special and different kind of emotion, and it comes from a profound sense of loss. Sometimes we grieve the loss of people, and if you know somebody who actually died as a result of this infection, then you might actually be grieving a death. And a lot of people are also grieving the loss of events and opportunities and things they might have been looking forward to, like graduation ceremonies or spring celebrations. Or if you find yourself experiencing this grief, you can use the techniques that I already talked about in terms of managing that psychological stress. But the very special thing about grief is sometimes giving yourself permission to feel it and to sit in it and to move through that grief can be very powerful. It's very difficult in these cases, though, because you might feel guilty about having grief, because logically you might say, I know that we're trying to fight a virus and I know why these things need to be canceled, but you still might feel bad about that loss. And that's okay. It's okay to validate those feelings and recognize them and actually feel them rather than stuffing them away or swatting them away or pushing them down, because it's completely legitimate to feel this sense of loss with things that are canceled. Number 3, social isolation. If you are physically distancing yourself in order to be part of this solution, which hopefully you are at this point, it's going to be time to get creative if you're able to maintain social connectedness and social ties with others, whether that's the phone, video conferencing, or even scheduling activities to do them simultaneously. Maybe you and your sister-in-law schedule house cleanup time at the same time, and you talk on the phone as you clean up the house as if you're doing an activity together. That can be surprisingly powerful. And so get creative. Even if you want to write letters through the postal service, you could do that as well as a way of valuing that social connection. And actually, this strategy that we've used to keep physical distance between ourselves was originally termed social distancing. And we're trying to instead use the term physical distancing, because what's important is that you're actually not physically near others, but you don't need to isolate from your social connections and social contacts. We know that there's tremendous value in maintaining that connectedness. This might be the time to hop on social media and utilize that to connect with others, unless that exposure to social media is actually increasing your stress because of exposure to people posting things or talking about this infection. And so that might be a balance for you. But get creative and use tools, and remember that these connections are important. And again, you don't need to minimize any sadness that you feel or loneliness, as a matter of fact. And then lastly, panic. A lot of people have been saying, don't panic, just prepare, don't panic. And saying don't panic is, easier said than done, because nobody wants to panic. It's just something that happens, and it's very uncomfortable to feel, and it's very overwhelming. And so if you are finding yourself panicking, the suggestion is that you actually use techniques, and I'll share these techniques with you, but you use these techniques to bring the panic down to a more manageable level so that it's less aversive, but then you have a greater capacity to be thoughtful and planful and do what it takes to be prepared in the face of this. And so that's why people are saying don't panic. What they're really saying is it's not helpful to get to the point where you lose your capacity to think rationally and to problem solve and to take the necessary steps to engage in the physical distancing and to cancel some of these events and to support our healthcare system in slowing the spread of this virus. And so in our podcast episode called Intense Anxiety, we actually go into great detail about the distress tolerance techniques to stop panic in its tracks. But briefly, we do suggest using techniques that stimulate the vagal nerve in order to shut off the panic response in the body. So that involves putting ice or ice water on the face in order to stimulate that nerve that slows the heart rate and slows breathing and stops panic. Not everybody has access to that at all times, but if you do, that can be very powerful in bringing your anxiety down from a 10 out of 10 level to maybe an 8 out of 10 level or a 7 out of 10 level, where you can do other things at that point to regulate your emotions. The other way we can stimulate that nerve is through the use of a very special and specific breathing technique where you're breathing out for a longer count than you're breathing in. And there's a magic ratio where you're breathing out longer than you're breathing in that stops panic and brings down the intensity of anxiety. So for example, for me, I like the ratio in for a count of 4 and breathe out for a count of 8. Like this. Breathe in, 2, 3, 4, and out. 2, 3, 4, 5, 6, 7, 8. And you do that for a few cycles, and that can actually help you stop that panic. It might take a few minutes, but it's just physiology. If you're a mammal, it'll work for you. You might find that too difficult to do. So if you want to start with breathing in for 4 and out for 6, or in for 3 and out for 5, that might be a good way to get started if you're really finding like you're not able to do the full in for 4 and out for 8. But if you want more information about these techniques, go ahead and check out the episode that we did about a year and a half ago called Intense Anxiety. That's available on the minddeconstructed.org or wherever you get your podcasts, however you're listening to this one now. So we're in this together. You know, it would be awesome if one day somebody said, what was all the fuss about? Why did we cancel all those things? That virus just up and disappeared. You know, that would be really awesome. And if that does happen, we will get the credit because we've seen in countries where the physical distancing was implemented too late and a lot of people ended up dying because there was what we call a surge on the healthcare system, and the system did not have the capacity to deal with all the health crises that we're presenting. So I dream of a world where one day people say, well, gosh, was that an overreaction? What was the big deal? That would be an awesome world to live in, and I think we can get there. So it's good that you arm yourself with this information. It's good that we win over this thing. We can do it. All right. Talk to you later. Bye.
Thank you for joining us today. This podcast was produced by Kaz and George. Music by Paul.
He's the best.
Contact us and send us your questions on Twitter at Mind Deconstruct.
Hello? Hi, am I calling too late? I'm just in the middle of recording my podcast, but do you have a quick update? No. We're being recorded right now. Okay. Is there anything you want to say to the podcast audience? Wash your hands. All right. I'll talk. Do you want to call in like 10 minutes? I'll be done. All right. Thanks. Bye.